Hi, I'm Dr. Ray Wisniewski, America's Healthcare Answer Man. We're here to talk about how to take care of a herniated disc. Number one, we need to really respect these. They are the largest avascular structure in the body, which means that it can take 9 months to 12 months to heal. So on your day-to-day basis, we want to do things right. Number one, we want to correct the positioning of that using specific chiropractic adjustments to allow that back to its normal position so that we relieve the stress on the disc. But let's take a look at what we're going to do on a day-to-day basis. Number one, you want to protect this using a brace, but you don't want to use a brace that has elastic. It can have some elastic, but it has to have some general material that's non-stretchable so that we can tighten this up, and that by tightening that allows that intra-abdominal pressure to take the pressure off of the disc. The other thing, do not sit too much. Sitting is going to put a lot more pressure on the disc than lying down or even standing. In fact, sitting puts twice as much pressure on the disc as does standing. We're going to have to watch coughing, straining, no straining. Above all, do not twist, particularly if it's in the lumbar spine. The lumbar spine, the lower back, is designed to move forward and backwards. That's the direction of the facet joints, which is the direction of the strength of the disc. So those disc fibers are oriented up and down, not across. So when we twist, that allows that to tear more easily. In fact, that's what created that in the first place. It had to have torn. So any type of twisting mechanism is going to cause a problem. Next, we want to make sure that we're sleeping properly. To hydrate this, we're going to use some particular motion, some stretching. We can lay on our back, pull our knees to the chest. I would recommend doing this the first thing in the morning and the last thing before you go to bed, or if you've done any type of compression of the disc where we're lifting something, which we shouldn't be doing, standing too much, sitting's even worse, then we're going to lay on the floor, gently pull the knees to the chest. That will cause this decompression within the disc itself. So those are some of the things that we can do to take care of and allow your disc the best chance.